Welcome to our September colloquium with the two guests, Dr. Michaela Coenen and Brigitte Strahwald, and they will speak today on simulation games on climate health as a teaching format, the results and challenges. Dr. Michaela Coenen and Brigitte Strahwald will report on the simulation game on climate health they developed as a new teaching format. They'll also present the results of a cross-sectional study on the knowledge of and interest in planetary health in health-related studies programs in Germany. Dr. Coenen is the head of the research unit for health promotion and prevention and the course coordinator for the Masters of Public Health at LMU. She has a diploma in psychology and a master's degree in public health and received her Ph.D. from the Institute for Health and Rehabilitation Sciences, also from LMU. Mrs. Strahwald is responsible for the coordination of the Pettenkofer School of Public Health. She studied medicine and has a master's degree in medicine ethics and law and a master's in epidemiology. We're very excited having you both today here, and the floor is yours.
So, thank you for this introduction, and I ask Brigitte to share the slides. Here they are. So, just one arrangement here from my side. Perfect. So now we are happy to present our experiences with simulation games on climate health as a new teaching format, results and challenges. So first of all, who are we, and how is the institution, the Pettenkofer School of Public Health, designed? So we, Brigitte and I, are from LMU Munich, and LMU Munich is part of the Pettenkofer School of Public Health, together with the partners, the Helmholtz Center in Munich and the Bayerisches Landesamt für Gesundheit und Lebensmittelsicherheit, the Bavarian Health and Food Safety Authority. At LMU, the medical faculty and the chair for public health and health services research, with Eva Refus as chair, is our home, the home of Brigitte and me. And at the chair, there is the master program Public Health. And at this master program, so around about 60 master students enroll every winter term. And also physicians coming from the public health departments in Bavaria join some of our courses. And this is also the case for the course and the module we present today. So here you can see the whole picture. It's very overwhelming of the partners of the Pettenkofer School. So why are we here today and what we want to present today? So we want to present the conception and implementation of a new teaching module as a simulation game with a reference and focus on planetary health and science communication. And this is the link to the Munich Science Communication Lab. And planetary health and science communication are one of the core topics to be taught in the master program at LMU Munich. So we had this module in the first term of the Master of Public Health called Practice and Policies in Public Health. And one of the focal points in this module is the health impact assessment. I will tell you on the next slide what is a health impact assessment. And up to now, we performed lectures, we gave lectures on health impact assessments. The students did some self-studies, they attended at a panel discussion with invited experts, and then submitted a term paper as the examination. we realized that we had some challenges here. The module and the health impact assessment teaching was very time consuming and associated with an enormous effort for lectures and the program coordinator. It was inactive. It was a very inactive learning format and also associated with a great effort for students. And I think this is the most important thing, with a very limited learning impact. So in a nutshell, what is a health impact assessment? A health impact assessment is a standardized process established by WHO, and it is a tool and approach to be applied to judge the potential health effects of a policy, program, or project on a population or on vulnerable and disadvantaged groups. So a health impact assessment provides recommendations for decision makers and stakeholders, and it aims to maximize the positive health effects and minimize the negative health effects of a program or a policy. So on the slide, you see some examples for which a health impact assessment can be done. For example, introducing a city toll or implementing a meat tax in a specific country, or, for example, establishing climate protection measures in a neighborhood. So now, realizing that we had these several challenges with our old learning format, we decided to reboot our teaching, our lessons, and also the exam. And we wanted to implement new learning objectives. You can see the learning objectives here. We wanted that students know and understand the basic principles and steps involved in developing a health impact assessment. We wanted that students can analyze and evaluate exemplary selected health impact assessments on a given topic. And in this first term, we decided to have health, climate, and planetary health as a given topic. And we wanted that students can synthesize the results and can apply the knowledge on health impacts assessments for decision-making processes. And yes, and in doing so, we want to profound the knowledge, the students' knowledge. We wanted also to enhance the critical thinking of students, and also that they improve their practical application of the health impact assessment. And in doing so, we introduced a simulation game as a new learning format in our master program. And in this learning format, we wanted that participants can experience a selected part of the reality by participating in a simulation of that reality. And Brigitte will present this in detail afterwards. And as Paula already mentioned, we decided on planetary health because we did a needs assessment on students at universities in Bavaria, and also together with Eva Maria, who is here today. And we wanted to know what the students know about planetary health. And we included more than 1,400 students in health-related studies. And as you can see here, most of the students had not heard about planetary health before, and are very interested to learn more about planetary health, and said it would be very important to embed planetary health topics within their studies. So, and in case you are interested to learn more about the study, you can find the publication on the study here. So, Brigitte.
Yeah, and now let's have a look at how we proceeded there. And starting with step one, in order to be able to work meaningfully on the method of a health impact assessment, the students attended a lecture on it, and we will come later to this again. In order to be able to create scientific posters, we also offered a poster workshop. And especially, of course, this HIA workshop was targeted to gain profound knowledge. For the next step, we have selected 3 exemplary health impact assessments. And this was an individual task. Each of these health impact assessments had to be read and analyzed and critically evaluated by the students, meaning, does it meet the criteria of a health impact assessment? Are all the necessary steps taken? What does it say, etc.? And as a working aid, we've developed a checklist for this purpose. In the end, however, the students should, above all, critically compare these 3 health impact assessments and present the results on a poster. And that's why we had offered the poster workshop. Again, this is about profound knowledge and critical thinking now. And here you see the 3 examples we've selected. It's one paper on, or one health impact assessment on heat-related respiratory hospital admissions in Europe in a changing climate. One about assessing the health impacts and benefits of regional climate action plan strategies in Western Massachusetts, so the other part of the world, and health impact of climate change in Pacific Island countries. So this marked the beginning of the group work phase then in step 3. There the task was to analyze in depth one of the 3 health impact assessments in a team. So, which means the group had to discuss their individual findings, compare that, and develop a kind of common understanding. And this as a preparation for the simulation game. This is mainly meant to strengthen the critical thinking. And with that now, let the games begin. In step 4, we had this simulation game. What you see here is a tight schedule for the simulation game. We had 3 rounds and an evaluation at the end. The background for that was the scenario, a heated climate debate as we have it, an unclear impact on both individual and public health of heat waves, climate changes, anything correlated to that. And now we imagine being in Bavaria as we are, having loud voices from different sides within Bavaria, be it population, politicians, especially at the communal level, or from the big cities, physicians, healthcare providers, etc. And so that the Bavarian government sees a need for action. And our fictionary setting is that the Bavarian Ministry of Health convenes a council of experts. And our roles, or the roles of the students, were that they were meant to be the scientific team to support this council of experts. And in round 1, we had the concrete task, a question, that this council of experts wants to be informed what is a health impact assessment, because we had suggested to do such a health impact assessment about the climate or about heat-related impacts, but the council does not really know what that is. So first, they want to be informed what is a health impact assessment, what are the strengths, what are the weaknesses. And with that, we started to play in 10 groups. And these were the groups that had already been formed for the group work beforehand. So each group was given a different task, which had to be solved in 50 minutes. So the groups then presented their results in 3 minutes each. So you see the time pressure, which was part of the simulation game. And above all, we could get an overview of all the team tasks or results. In round 2 now, the Council of Experts wanted to know, are there any examples for health impact assessment, because they still didn't know whether the method would be worth the effort. And this now refers to the preliminary work within the groups. You remember that they had to compare their individual results of their critical analysis of one of the 3 health impact assessments. And now they have to answer concrete questions on that again, and present their results. So there is a little more time for the step, but it's more time consuming, because the premise is it must be communicated in a way that it is easy to understand for politicians and decision makers. That means briefly and to the point. And based on that, or based on these results, now we come to the last step. The Council of Experts now wants a hearing with stakeholders. And the stakeholders are members of the Bavarian Ministry of Health, the city of Munich, the city of Hof, so both big cities and smaller cities, a public health office, physicians, Gesundheitsamt Vertreter here from Dachau in that case, the press, of course, but we also had climate activists and citizens as part of the game. And now some of the students changed their roles and become stakeholders. And for that, we had also developed rolled cards. They had a short time to prepare for their role, for example, to prepare statements or questions. And the hearing itself then took 45 minutes, was very interactive and vivid. And what you see here are a few impressions from the day. So on the first photo, you see just how they worked in the teams before. And on the second, this is the scenario of this hearing, the students who had the role as part of the expert council. And on the other side, you see the stakeholders. And we ended up with a feedback round on the learning effects or impressions, considering, well, both process and content. And finally, in step 5, the students had to sum up their findings from that day and formulate recommendations to the expert council, again, presented as a poster, and again, to strengthen the critical thinking. So that briefly, how that worked, so how we developed this concept and implemented it. Now, what are the lessons learned? And for that, I hand over back to Michaela.
Oh, thank you, Brigitte. So our lessons learned are so far, so because it was the first time we implemented the simulation game in the master program. So it was a kind of a piloting this simulation game. And of course, we realized that it was very time consuming and had an organizational effort mainly for Brigitte and me, and to set up all the concept and all the educational materials. You saw the cards we prepared for the simulation game. So we then realized, and from my perspective, this is the most important thing. We were able to implement a very active learning format. So all the students, because of the different roles they have to took over, they were very actively involved in the simulation game and the different steps we performed. The effort for the students remains high, because they have to prepare the poster beforehand, they have to attend the simulation game, and afterwards they also had to prepare the second poster. We think that the learning impact was very high, but we need to evaluate this when we come to the next round for our simulation game. But we also received very positive feedback of the simulation game and the process at this day from the students. So this was, very briefly, our our experience with the simulation game and the master program Public Health. And yeah, we will be happy to answer some of your questions. Thank you.